Medical nutrition therapy. Medical nutrition therapy, MNT, is a process that uses a combination of nutritional and medical techniques to treat various conditions. The term medical nutrition therapy was first introduced in 1994 by the American Academy of Nutrition and Dietetics. It is the largest organization of nutritionists and other credentialed nutritionists in the United States. With the approval of the patient's doctor, medical nutrition therapy can be carried out in various settings. It can be done in a hospital or an outpatient clinic. This video reviews how medical nutrition therapy works and how it can aid some common medical conditions. How medical nutrition therapy works. MNT is based on decades of medical research on the relationship between diet, nutrition, and health outcomes. Unlike nutrition education, which is mainly focused on providing basic nutrition information, medical nutrition therapy is not intended to diagnose or treat specific conditions. Instead, it focuses on the overall health of the patient and helps them make informed decisions regarding their diet. This type of therapy also addresses the risk factors that can affect their health. Steps and scope. After gathering information about the patient's health condition, an RDN uses a comprehensive assessment to develop a personalized care plan. This includes a nutrition diagnosis and a variety of interventions designed to help the patient improve their health. RDN is the food and nutrition expert who can translate the science of nutrition into practical solutions for healthy living. The RDN then visits the patient multiple times to monitor their progress and provide them with support. This type of therapy also involves assessing the patient's behavior and medication changes. Only a qualified dietitian can provide medical nutrition therapy. It can be done in a hospital or an outpatient clinic. It can start during the patient's hospitalization or continue until the patient's RDN is able to see them. The complexity of medical nutrition therapy can vary depending on the patient's condition and goals. For instance, it can help treat severe burns by prescribing a high-protein diet. In severe cases, such as those with cancer, an RDN can recommend intravenous or tube feeding to prevent malnutrition. The duration of medical nutrition therapy varies depending on the patient's condition and goals. It can usually be done until the patient's nutrition-related diagnosis has been resolved. How medical nutrition therapy can help certain conditions. MNT can be a very effective component of the overall management plan for a number of common diseases. Diabetes. High blood sugar levels are known as diabetes, and this condition can be caused by either a lack of insulin production or a failure of the body's ability to use insulin properly. If left untreated, type 2 diabetes can lead to various complications, such as kidney disease, nerve damage, and heart disease. Research shows that MNT can help control diabetes. Studies also suggest that this type of therapy can help lower blood sugar levels. For instance, it can help lower the hemoglobin A1C level. It can also help manage gestational diabetes, which is a condition that occurs when a pregnant woman has high blood sugar levels. The goal of this type of therapy is to help the patient maintain a consistent diet and control their blood sugar levels. This technique involves teaching the patient how to count and portion control their carbs. Heart disease. Aside from high blood pressure and diabetes, other conditions such as heart disease can also affect the heart's function. Left untreated, these conditions can lead to various complications, such as stroke and heart failure. Medical nutrition therapy can help lower the risk factors that can lead to heart disease. For instance, it can lower bad cholesterol levels and high blood pressure. A dietitian may recommend that you adhere to a diet low in saturated fat, cholesterol, sodium, and inflammatory foods. Emphasis may be placed on increasing fruits and vegetables and following a more plant-based diet. An RDN can also help patients maintain a healthy weight and lower their risk of heart disease. In addition to diet changes, the RDN may also suggest other lifestyle changes such as getting adequate sleep. Cancer. A cancer is a disease that starts to divide uncontrollably in different parts of the body. It can affect organs such as the blood and bones. One of the most common reasons why a dietitian may be involved in a cancer treatment is to help patients with their appetite. Radiation therapy may also damage the gastrointestinal lining and make it painful to eat or difficult to digest foods. Many people with cancer are at risk of malnutrition due to their low levels of nutrients. An RDN can help them consume adequate amounts of nutrients by suggesting high-calorie nutritional shakes and other fat and protein-rich snacks. In severe cases, an RDN may recommend tube or 4 feeding. Digestive conditions. Aside from cancer, Other conditions such as gastrointestinal disorders can also benefit from nutritional therapy. For instance, people with conditions such as irritable bowel syndrome and ulcerative colitis can benefit from this type of therapy. These conditions can lead to various issues, such as malnutrition, poor nutrient absorption, and a buildup of toxins in the colon. A dietitian can create a customized nutritional plan that fits to the needs of a specific condition. This type of therapy can help patients feel better and reduce their symptoms. For people with inflammatory bowel disease, a supervised elimination diet can help them reduce their symptoms. This type of therapy involves removing certain food items from their diet and slowly adding them back to their diet. Kidney disease. Untreated kidney disease can lead to various health issues, such as poor kidney function and high levels of potassium and calcium in the blood. MNT is useful because most people with kidney disease may need to adjust their diet. Some people with kidney disease should limit their nutrients intake to a certain amount, while others may need to follow a certain fluid restriction. This is because the disease stage or severity affects the individual's body. High blood pressure is also a common issue for people with kidney disease. This condition can raise their risk of developing other health problems. When should MNT be implemented? Like other medical treatments, MNT has an appropriate time and place. After an in-depth evaluation by a registered dietitian, MNT is usually prescribed for patients who are suffering from a medical condition. Although it's usually necessary for certain conditions, such as kidney disease, MNT is sometimes not needed for people who are not at risk of developing malnutrition. For instance, people who are undergoing a procedure and are eating well may not need to take on MNT. An RDN is also usually ordered to provide a nutritional assessment when a patient is admitted to a hospital. In most cases, an RDN will also be consulted if a doctor suspects that a patient might be suffering from a nutrition-related issue. MNT is common across various developed regions, including North America, New Zealand, Japan, and parts of Europe. The bottom line: MNT is a well-established, nutritional approach to alleviating, managing, and even treating certain medical conditions. It has been shown to be effective in treating various chronic conditions, such as diabetes, cancer, and heart disease. Before you start MNT, it's important that you first talk to a dietitian about your condition. They can then provide you with personalized advice regarding your diet and treatment.